Hi everyone, this is Dr. Jonathan Kuttner. Today we're going to talk about a really fascinating and unusual trigger point that occurs in the body. In fact, just 2 weeks ago, a lady came into my office who described, and she was incredibly puzzled about this. She said, I was walking along, 1 minute I was walking along and the next minute I was on the ground. I said, what do you mean? She said, exactly that. I was walking along and then suddenly I was on the ground. So the questions that as a doctor I think, okay, did you lose consciousness? No, I didn't lose consciousness. I was aware that I was up here, and then I was aware that I hit the ground. I felt it. I felt myself land on my knees and my hands. She fell onto all fours. And what happened then? Well, I just thought, that's weird. I'm on the ground. And then she kind of felt around and then felt, and there was nothing odd, and she hadn't tripped, nothing. And then she slowly stood herself up, now feeling weird and also worried because, as she said, what would happen if I was crossing a street? Or what was happen, and it was her right leg, and what happens if I'm driving a car? What happens if my leg like this? So there's a whole lot of questions that rose up in her head, and in fact, this had happened twice. But the first time, she'd felt her leg buckle, and the second time, she had hit the ground. So the first time, her leg had just buckled, and she thought, God, that's weird. And the second time, obviously, was the thing I described. So I examined her. We did a full neurological examination, because the question is, had she had some kind of minor stroke, had something like this happen? And there was no abnormality to find. And in fact, she was a very, very healthy person, apart from this strange episode that had occurred. And then I looked, because this is putting on a different hat. Now I'm not a doctor looking at a neurological problem, but I'm actually looking for a musculoskeletal reason. And what I found was that she had a trigger point in the vastus medialis of her quadriceps. Now that sounds complicated, but really what this is on the inside of her thigh, just above the knee, there's a fascinating muscle. This muscle is the inner part, the medial, in medical terms, part of the quadriceps, which is your quads. These are the big muscles that big muscle that forms the front of your thigh. The vastus medialis is a very, very powerful part of the inner portion of the quadriceps muscle, and it is the balancer of your kneecap. So as you go to stand, the full force of the muscle tends to pull your kneecap up and outwards, if it's the right-hand side, and the vastus medialis straightens. So instead of sliding out sideways, the vastus pulls it in, and it is used however many times you walk and however many times you straighten your leg. If you get a trigger point in the vastus medialis, unlike trigger points anywhere else in the body, it goes into overload, and once it's in overload, it just switches the whole muscle off, which is fascinating. And this is what happened with her. As she went to step, the vastus medialis fired up, and then it just went into overload, turned the whole of her quadriceps off, and her leg just buckled. There was nothing there. And it buckled so profoundly that she went to step, and the next moment she was on the ground on hands and knees. And I treated the trigger, and in her case what I did was I injected. So I found it was exquisitely tender, and I put a syringe with a very fine needle into, and there were multiple little trigger areas, And each one, as the needle hit it, she had, she said, oh, it's like a little electric shock. And she had maybe 8 or 10 of these little things in this area. So I puffed a little bit of local into each one, showed her how to switch it off herself and how to stretch it, and she went home. And since that time, she said that her knee feels infinitely better. She's had no further collapses, no further buckles, nothing. So this is fascinating. An unusual trigger that occurs in an incredibly important part of your musculoskeletal system, which when this trigger turns on, actually can put your life at risk. Thank you.